now I'll tell you about myself and what made me get interested in VR and the combination of VR and the healthcare system. 4 years ago, I was diagnosed as suffering from cervical disc herniation due to active flight. I'm a former F-16 pilot in the Israeli Air Force. And doing my own rehab process, I discovered that any healthcare system is suffering from major flaws, lack of access, poor monitoring, and poor compliance, and increasing cost. And we believe that VR is the solution. And the reason why we believe VR is the solution is that once you put a VR headset on and hold the two controls, you become part of that computer-generated environment. Once you become part of that computer-generated environment, we can quantify everything that you do inside that environment. Once we can quantify everything that you do inside that environment, we can start quantifying outcomes. We can start comparing between physicians, between providers, and manage the process better. The second element is that putting a VR headset on has psychological aspects. I'm assuming that all of you saw people bouncing into walls while putting a VR headset on. That's because it's so immersive that you actually feel that you're there. And no one want to be in a rehab center, no one want to be in the hospital. And VR system enable patient to escape even for a short period of time. And the third element is that you don't have to be in a hospital. You can be, again, as I read you previously, you can be back home and do the same process remotely. And that's what we are doing. We are creating virtual reality environments, or basically taking the golden standard protocols, model them into a virtual reality environment, letting the user or patient interact with that environment, measure their performance, and provide insights for providers, payers, and the user themselves. We are developing application in different kind of verticals: physical therapy, cognitive rehab, psychological treatments, and even pain management. And it's already been shown that VR could be a very good replacement for any kind of painkillers. And it's a in a short period of time, you'll start seeing patients using VR, doing chemotherapy, during dialysis, or different, or using VR in any unpleasant surroundings in the clinical settings. Every time someone is using our platform, we are generating a snapshot about his current status. And by capturing those snapshots, we can now, as I mentioned previously, start comparing between outcomes of different patients and create big data analysis that will help providers to manage their process better. We are launching this holiday season a VR platform designed specifically for the 50+ market. And the idea is that, again, the 50+ population will be able to use VR in order to improve their well-being. As you can hear from my accent, I'm not originally from here. Company is based, or the R&D is based in Israel, and the business unit is based in Boston. We are, as far as we know, the only company that is using VR as a certified medical device. All our applications are FDA registered or about to be registered. We completed the ISO 13485 as a medical device company, and we are using VR as a certified medical device. We have a lot of partners and growing rapidly on a daily basis. I think that we see more and more people understand the huge potential that VR has to offer. And we just crossed, from the moment I wrote those numbers, it was a week ago, we already crossed the 1,500 VR treatments and over 300 patients. And I think that that's maybe the most important elements that we are seeing a high adoption rate from the patient because they're inside the immersive and fun environment, and the experience is much better than any other medical procedure that they used to have. And from the provider point of view, our system or our platform provide them with analytics and insights that till now was very hard to provide. And again, I think that the adoption rate shows that we are providing value for both sides, and we believe that that's the only way to get new technology out there and get reimbursed. Questions?
I'm sorry, I didn't see.
My question was, you addressed that you are kind of going after the 50-plus population for wellness. Using VR, how do you plan on doing that? And the second part of that question is, how are you dealing with folks that are going absolutely against VR and against technology, especially with the senior population?
I think that's one of my favorite questions. We did a user testing with, and you can see the testimonials in our website. One of the amazing thing about VR is that you don't need to be, or you don't need to have any technology knowledge or expertise, or you don't need to be tech savvy. So in the user testing that we did with ARP members, we asked them to play virtual reality games. No one had any issues playing those games. And then we asked them to fill a survey with a tablet. No one was able to fill the survey in the tablet. But they didn't have any issues regarding interacting with the virtual reality world. That's the power of VR. It's very natural and it's very compelling. And I believe that the first market to adopt that technology is the elderly population and not the other way around because of that. And for them to put a VR headset on and be in Paris, it's much more compelling than the young population that are always with their smartphones and they're very tech savvy.
Thank you.
Any other questions? Yes, sir.
First of all, what you're doing is really great. Are you looking to do any virtual and reality? Like, are you looking to have a headset where you could then throw like a baseball or do something physical with your arms, or is it all going to stay virtual all the time?
So basically today, first of all, if I wasn't clear, we are a software company. We're using off-the-shelf hardware products. In the VR hardware space or in the VR technology, there are basically, even today, different kind of options to take objects from the real world and import them to the virtual reality world just by adding different kind of sensors. So basically, people today are doing baseball training in VR, much better than any other training that is out there. So it's already there, and what we are doing is just harnessing what the gaming industry is doing to the healthcare sector.
Do you have any case studies or results that you can share with us?
So maybe something that it's important to point out. We are not claiming to be more efficient, and we are not claiming to invent anything new. All we are saying is that we are taking the golden standard protocol, or the protocols that physician is using today, provide a much better and engaging environment for the patient, and provide much higher data, analytics, and insights for the providers. Saying that, I do believe that when we'll have sufficient treatments and data, we'll be able to determine which protocol is more efficient than the other. That's one. The second thing, I think that by improving compliance, we'll be able to improve outcomes. But we are not claiming that the VR is the one improving the outcomes.
More questions? Please give a round of applause to Eran.